Okay. So my presentation is on a simple case report of plagiocephaly in a cadaveric skull. So coming to the introduction part, the word plagiocephaly means oblique head, and the Greek word plagios means oblique and the cephaly means head. So plagiocephaly can be defined as asymmetric shape of the head due to unilateral flattening. Plagiocephaly can be divided into two pathogenic groups, cyanostotic plagiocephaly and non-cyanostotic plagiocephaly. There is a type of deformational plagiocephaly, DP, also called positional plagiocephaly, PP. Deformational or positional plagiocephaly is an acquired condition. Craniosynostosis is a congenital condition whose incidence is 1 by 2,000 live births. In a study conducted in 2012, prevalence was found to be 12% to 22%. The severity of deformational plagiocephaly or positional plagiocephaly can be tested with the help of Hutchinson severity score, taking diagonal difference of the skull. In case of this DP or PP, it can be divided into three major groups: mild, moderate, and severe. Mild form, where diagonal difference is more than 3 millimeter or less than 10 millimeter. In moderate, it is more than 10 millimeter and less than 12 millimeter. In severe cases of deformational plagiocephaly, it is more than 12 millimeter. DP or PP are non-cyanostotic plagiocephaly. The various risk factors for DP are a low educational level, young maternal age, bottle feeding, firstborn infants, supine positioning, premature births, prolonged intubation in male gender, and multiple pregnancy, and etc. So deformational plagiocephaly or positional plagiocephaly is due to non-cyanostotic condition. Basically, it's due to external forces which are present when child is placed supine. These forces deform the shape of the skull. Craniosynostosis is a premature fusion of the skull sutures, leading to frontal, parietal, or occipital plagiocephaly. In positional plagiocephaly, skull has rhomboid shape, and in cyanostotic plagiocephaly, skull has got trapezoid shape. Due to cyanostosis, this will not allow the brain to grow inside the solid skull. This can cause brain damage, delayed development, problems with thinking. Physicians advise to open the space between the skull bones to allow proper and adequate growth of the brain. They advise to wear helmets after surgery to protect the brain and the reshape of the bone. In my case report, during a routine dissection of head and neck region in a Department of Anatomy, All India Institute of Medical Sciences, Bhopal, we came across a case of plagiocephaly, means oblique head. After dissecting the scalp, the whole skull has been removed, exposing only the bony vault. On close observation of all the sutures, we found premature closure of the lambdoid suture on the right side. There was a partial fusion of the upper part and complete fusion of the lower part of the right side lambdoid suture. It means craniosynostosis of the lambdoid suture on the right side. This was causing flattening on that side. We also observed bulging or bossing of the right frontal area due to craniosynostosis of the lambdoid sutures on the right side. The brain was not getting enough space to grow on the posterior direction, so frontal part of the brain growing, leading to right side frontal bossing. There is also a bilateral coronal So here in this picture, the point A, it is frontal bossing on the right side. B, occipitomastoid bossing on the right side. Craniosynostosis of the lambdoid sutures on the right side. Yellow arrow, fusion of the coronal suture. It is found just behind the marked area A. Discussion. Dr. S. Ferris, B.S. Miriam, Nuno, D. Moyes, Mark, Krieger, and D. Doniel in 2013 found that plagiocephaly is mostly found on the right side. Craniosynostosis found along the rhamnoid sutures is very infrequent. Though infrequent, it characteristically presents with bossing in the occipitomastoid region and posterior shifting of the ear along with a bilateral coronal synostosis, which has the potential to present with the brachiocephaly. K. Mansoor, B. Mohsen Hassan, D. Behman in 2013 mentioned in his study that craniosynostosis is a premature fusion of the skull sutures leading to frontal, parietal, or occipital plagiocephaly. In positional plagiocephaly, skull has got rhomboid shape, and in synostotic plagiocephaly, skull has trapezoid shape. Positional plagiocephaly typically consists of right or left occipital flattening with advancement of the ipsilateral ear and ipsilateral frontal bone protrusion, resulting in visible facial asymmetry. Occipital flattening may be self-perpetuating in that once it occurs, it may be increasingly difficult for a patient to turn and sleep on the other side. So from the case report, we can conclude that if a proper knowledge of the plagiocephaly and its type may lead a pediatrician to come to a differential diagnosis of delayed milestone development. So these are the references. Thank you.